Hi, I'm Devin with Medikit Health, and welcome to this installment of the Medikit Minute, where we're looking for feedback and thoughts on today's topic, front-end revenue cycle management. Now, front-end revenue cycle is everything that happens before the claim gets submitted for payment. In these next few videos, I'm going to share 5 front-end processes that lead to poor revenue cycle management and what you can do to remedy these problems. These things often lead to denials and rejections, decreased revenue and cash flow, and unhappy staff, including higher days in AR. Today, I'm sharing number 1. The very first step where revenue cycle can go wrong is when the patient gets scheduled the very first time. One wrong mistake here and the payment can get denied. Simple errors in data entry, like transposing numbers such as date of birth or member number, leads to rework, staff time, resubmissions, and costs more time in AR. However, if you set up a patient portal, pre-registering patients allows you to gather data about their insurance coverage, possible secondary coverage, the number of allowable visits, and the patient's financial responsibility before they're ever set up in your system. I'll be sharing the other 4 tips in my upcoming videos. In the meantime, I'd love to hear any other challenges or solutions you've found that help you improve your revenue cycle management. Have a great one.